Today I'm going to deal with the skeletal system, the gross anatomy of the skeletal system. Remember, like last time, we dealt with the histology of bone and cartilage. So today we are going to deal with the gross anatomy of the skeletal system. And just to remind you that there is a virtual anatomy lab is associated with this topic. So you will find it. You will find the video in the virtual anatomy on Brightspace in the course content. This is the first virtual lab that you have. The video was prepared by my colleague, Dr. Gary Allen. And after the video, there are questions. So it is recommended that you answer these questions. It's for your self-assessment. You are not required to submit the answers to us. These are not assignments. It is just for your self-assessment and practice, because they are the type of questions that you are going to have in the midterm practical. Okay? So this will be the first virtual anatomy lab for you. Now the axial skeleton is divided into two parts. The skeletal system is divided into two parts, the axial and the appendicular skeleton. Today we are going to deal with the axial skeleton, and next week, the next lecture, it will be about the appendicular skeleton. The axial skeleton has about 80 bones. These are not exact numbers, because sometimes there is an extra bone, sometimes there is a missing bone, sometimes there is some of the bones they do not ossify completely. Remember that bones, most of them, they might come from a cartilage, cast of cartilage. So there are variations. It is not exactly 80 bones, or it is not exactly 126 bones, but these are approximate numbers. The axial lies along the axial longitudinal axis of the body and includes the skull, hyoid, vertebrae, ribs, sternum, and the ossicles of the ear. You can see here these ossicles. They are very small, tiny bones, 3 ossicles, the malleus, incus, and stapes. Compare their size with the size of the fingers. Very small, 3 ossicles present in the middle ear. The appendicular skeleton, which we are going to deal with next time, contains the bones of the limbs, the upper limb and lower limb, and the girdles that connect the limbs to the axial skeleton. So the axial skeleton contains consists of the skull, and as you can see here, the skull, the bones of the skull are fused together. There are cranial bones and facial bones. Facial bones form the bones of the face. Cranial bones, they form the cranial cavity that encloses the brain. And so the cranial bones, they protect the brain, they house the ear ossicles, they provide for muscle attachments for some of the muscles that move the mandible, like probably you can feel here. If you clench your teeth, put your hand above the auricle and try to clench your teeth, you will feel that there is a muscle popping up. This is one of the muscles called temporalis that's located in this region, and it closes or elevates the mandible. And there are also some facial muscles attached to it. The facial bones, they protect these delicate sense organs, like the eye for vision, the nose, and the mouth. And they also protect the entrance of the respiratory and the upper digestive tract. The cranial bones are several bones, as you can see them here. Some of them are single bones, like the frontal bone, and then we have double parietal bones on each side. And then posteriorly is the occipital bone, and laterally in this region there is the temporal bone. Also there is the sphenoid bone. So the sphenoid bone also forms, as we will see, part of the floor of the cranial cavity. It's a very complicated bone. You can see it from different views. So these are some of the bones. There's also the ethmoid bone, which is located in the medial side of the orbits. The orbits, this is the region. These are the orbits. They contain the eyeballs. So because the eyeballs rotate in this cavity, the cavity is called the orbital cavity, or the orbits, because they contain the eyeball rotating around. And then here's the frontal bone again. You can see here, this is a sagittal section of the skull. And see that the frontal bone not only forms the frontal part of the cranium, but also forms part of the floor. Look at the cranial cavity. It has 3 levels, like the steps of a staircase. There is a front and anterior, middle, and posterior cranial fossa. And so the frontal bone forms part of the floor of the anterior cranial fossa. And also you can see here in this section that it contains a space which is called the frontal sinus. And this space is connected to the nose, actually. So actually this air sinus is also called paranasal sinus. You will find that there are 4 of the bones of the skull contain these sinuses. So we have 4 paranasal sinuses. One of them is the frontal sinus. That's why when these sinuses gets inflamed, patients might have frontal headache, because actually they are present within the frontal bone. The parietal bones are double, and they are present on the side of the skull, the green one here, the parietal bones. And then we have the temporal bone. You can see the temporal bone has several parts here. One of the parts, this is the flat part of the temporal bone. So sometimes also it's called the squamous, because squamous is flat. Remember the squamous epithelium. So this is the squamous part of the temporal bone. It has a process called the zygomatic process, which articulates with the zygomatic bone. The zygomatic bone is the bone of the cheek. It's one of the facial bones, and it articulates with the zygomatic process, forming an arch, zygomatic arch. There's another process here, which is called the mastoid process. You can feel it behind the auricle of the ear. It's the mastoid process, and just in the front of the mastoid process is the external auditory meatus. This is part of the external ear, the bony part of the external ear. If you put your finger in the ear, then part of it is cartilaginous, the deeper part is bony, and this is the external auditory meatus. Just in the front of the ear, there is a fossa, which is called, a fossa means a depression in the bone. So it's a fossa. This is the mandibular fossa, because it articulates with the mandible at a joint which is called the temporomandibular joint. So if you put your finger in front of the auricle, in front of the tragus of the ear, open your mouth, you will notice that your finger dips in. If you open your mouth, your finger dips in because the mandible moves, and this is the location of the temporomandibular joint, just in the front of the tragus of the ear. And you push your finger, the mandible moves, your finger dips in. This indicates the close relationship of the temporomandibular joint to the ear. And the temporomandibular joint is called so because it is the temporal bone that participates in its formation, the mandibular fossa of the temporal bone. The temporal bone is so named temporal. Temporal means related to time. So it was so called because this region, they call it the temporal region. It is the first gray hairs appear in this region. So this region reflects time. That's why it's called the temporal region, and the bone is the temporal bone, the muscle is temporalis, the joint is the temporomandibular joint, and that's how the names were derived from this story. The occipital bone is the bone that is located posteriorly in the occiput, and you will see that it has a very big foramen. There are multiple foramina in the skull, in fact, like this one, this one, this one. A lot of foramina are present in the skull, and these allow the passage of nerves and vessels, like the cranial nerves and the vessels that supply the brain. But this one is the biggest of these foramina, and that's why it's called foramen magnum. Foramen magnum is the foramen that is present in the occipital bone, and it allows the passage of the spinal cord. So the spinal cord passes down from the brain, from the medulla oblongata of the brain, through this foramen magnum, and on either side of the foramen, like this one here, the other one is there, are condyles, occipital condyles, and these articulate with the first cervical vertebra, the atlas vertebra, the first one. So forming a joint, the joint that we use it in nodding, this joint, the S joint. Okay? So this is the occipital condyle on the side of foramen magnum. The other bone is the sphenoid bone. You can see that the sphenoid bone looks like a butterfly. If you look at it here from the inside of the cranial cavity, it is wedge-shaped, or it is wedged between the bones of the skull, and you can see that it is located behind the other bone here, which is called the ethmoid. So the ethmoid is anterior, and then you have the sphenoid bone. The upper part of the sphenoid bone has a fossa. See, if you look at it from the medial side, from the sagittal section, you will see this fossa. It's called the pituitary fossa, or they call it the sella turcica, which means the Turkish saddle, because it looks like a saddle of a horse. So they call it the sella turcica, and it contains, or it houses or protects the pituitary gland. We're going to talk about the glandular system in the next block, and this is the pituitary gland. It's a very small gland located at the base of the brain and housed by the sella turcica. Just beneath the sella turcica, there's a cavity within the sphenoid bone. This is the other paranasal sinus, sphenoid sinus. It's an air sinus. Remember, we mentioned that there is the frontal sinus, and this is here is the sphenoid sinus. Then we have the ethmoid bone. Ethmoid in Latin means like a sieve, and it is called so because it has multiple foramina here, also called cribriform plate. A lot of foramina here, and these allow the passage of olfactory nerves. This region, which is in the floor of the anterior cranial fossa, is immediately at the roof of the nose. So it forms part of the roof of the nose, and through it, the olfactory nerves pass up to the brain. So that's why there are multiple foramina here in the cribriform plate of the ethmoid bone. Ethmoid bone is so complicated bone. You can see it from, it has different parts, and you can see it from different locations. Inside the bone, there are also sinuses. So they are called ethmoid air sinuses. This is the third group of sinuses, of paranasal sinuses. So we have frontal, sphenoid, and ethmoid sinuses. It also forms part of the nasal septum, which is present between the nostrils. There's a nasal septum. We can move part of the nasal septum because partly it is cartilaginous and partly it's bony. The bony part is formed by, again, part of it is formed by the ethmoid bone. And on the lateral side of the nose, you can see here we have the conchi, or the turbinates. These are bones which look like shelves on the lateral side of the nose, and they are covered, of course, by mucous membrane, and the idea is that this will increase the surface area for filtration of the air, surface area for the humidification of the inspired air. Okay, so these are shelves on the lateral side, and there's a septum in the midline, and the roof is perforated by the olfactory nerves. This is the ethmoid bone. You can see them here. Paranasal sinuses on either side. This is the nasal septum, which is formed partly by the ethmoid, partly by the other bone, which is called vomer. And then it is formed by cartilage. Here's the superior concha and the middle concha, like shelves on the lateral side of the nose. Actually, they are bones, but here they are covered by the mucous membrane, the respiratory epithelium. Here the lining, remember the lining, pseudostratified columnar ciliated epithelium with goblet cells. This is the lining epithelium that covers these conchae, superior and middle concha, to increase the surface area for filtration of the air and for humidification. So far about the cranial bones. Now the facial bones, we have the nasal, small, very small, couple of bones, two bones, small nasal bones. And then we have the zygomatic, the bone of the cheek here, and the maxillae, the upper jaw, maxilla. And then we have the lacrimal bones, small tiny bones here, lacrimal on the medial side of the orbit. And then the palatine. Look at the palatine bones here. They form part of the hard palate. The palate is the roof of the mouth. You can feel it now by the tip of your tongue. There is a hard palate. Part of this hard palate is formed by the maxilla, here, the green one, and the posterior part of the hard palate is formed by the palatine bone. And then we have another bone, which is called the inferior nasal concha. It's another concha. The upper two conchae, superior middle, are part of the ethmoid, but the inferior is a bone by itself. And then the vomer, part of the nasal septum, together with the ethmoid bone. Look at the vomer here, and this is part of the ethmoid bone. Together, this is called perpendicular plate of the ethmoid bone with the vomer, will form the bony part of the nasal septum, which is separates between the nostrils, together with cartilage. Sometimes it deviates from the midline, which is called deviation, and has to be corrected surgically if it produces some signs and symptoms. Yes?
Right there says the two palatine bones. Is that just separated because they're right in the middle?
The palatine bone?
Yeah. There's two.
Two.
Next to each other?
Yes, they are next to each other. They come close to each other, and between them there is a suture. Yeah. So this is one here, there's another one here, and they are two. These are the paranasal sinuses. So the fourth one is the maxillary paranasal sinus. It is present in the maxilla, see? And these are connected to the nose. They have openings into the nose, 4 pairs, filled with air, lined by respiratory epithelium, connected to the nose. We have the frontal, sphenoid, ethmoid, and the maxillary sinus. They might get infected because of the spread of infection from the upper respiratory passages, and this will result in headaches and facial pain. The reason for their presence is not exactly clear. They might act as resonating chamber for voice. They change the quality of the voice. That's why when they get infected and blocked, the quality of the voice changes. They might lighten the skull bones. They might participate in more humidification of air, but it's not exactly clear why they are there, and why is it so complicated. They form all these complicated passages and spaces. The bones of the skull are many of the bones of the skull. They are connected by fibrous joints, which are called sutures, and these are immovable joints. In the adult, they are immovable joints. Remember, you have seen this slide before when we were talking about these planes of the body. So we have a sagittal suture here, which is located in the sagittal plane, and there's a coronal suture here, which is located in the coronal plane of the body. And look at here at the newborn skull. You will find that the sutures are widely separated, and there are spaces between the bones which are filled by dense connective tissue. So these spaces, in fact, are called fontanels. So we have many of these fontanels, but the main one is the anterior and the posterior fontanels. Remember last time when we talked about the ossification of bone, there is membranous ossification and intrachondral ossification. Most of the flat bones of the body, including the bones of the skull, they ossify by membranous ossification. So it's mesenchyme or fibrous tissue that changes into bone. And in the newborn, not all the bones of the skull are completely ossified. There are spaces in between them. The sutures are wide, and these spaces are filled by fibrous tissue, not by cartilage, because it's not an intracartilaginous ossification. The presence of these spaces will allow the bones to overlap, so that they can fit into the birth canal. So it allows molding of the fetal skull as it passes through the birth canal, and at the same time they will allow for the distension of the skull with the rapid growth of the brain that follows birth. Because if they are, and then they will close afterwards. So the anterior fontanelle, for example, closes at about 18 months, while the posterior fontanelle closes at about 2 to 4 months of age. If they close early, then this will result in a distorted shape of the skull, if they and might affect the function of the brain. So that's the reason that we have these fontanelles, to allow molding of the skull bones and to allow for the rapid growth of the fetal skull. And they reflect that the bones of the skull were developed from mesenchyme, fibrous ossification. It's not intracartilaginous ossification. So far about the skull. Now I will deal with the other axial bone, which is the hyoid bone. It's present in the neck, the upper part of the neck. It is U-shaped bone, and the unusual thing about this bone is that it does not articulate with any other bone. There's no articulation between this bone and any other bone in the body, but what's attached to it are muscles and ligaments. And these muscles and ligaments, they are parts of the tongue, muscles of the tongue, muscles of the pharynx, and it moves, like it supports and moves the pharynx and larynx and supports the tongue. But it does not articulate with any other bone in the body. It's the bone that is fractured in strangulation. Sometimes it's fractured, usually in strangulation. The other part of the axial skeleton is the vertebral column, and you can see it consists of multiple vertebrae or fused vertebrae, like in the sacrum and the coccyx. And obviously it supports the body and it supports the head, and surrounds and protects the spinal cord and the spinal nerves, and provides attachment for the muscles of the back that move the spine. There are 7, the vertebrae are in different regions. So in the cervical region, we have 7 cervical vertebrae, then 12 thoracic, then 5 lumbar vertebrae, then 5 sacral, which are fused together as a single segment, sacrum, and then about 4 coccygeal, which are fused as one coccyx. The coccyx is the tail bones of the animals. So they are fused together here and form a small piece, which is called the coccyx. Usually 4 segments fused in human, usually 4. So these are the parts of the vertebral column. The vertebrae, the separate vertebrae are actually connected with each other by intervertebral discs. These are intervertebral discs which are present between the vertebral segments. Each vertebra, as you can see it here, this is a superior view and this is a lateral view of a vertebra. In the superior view, you can see that the vertebra in general has a body and an arch, vertebral body and a vertebral arch. The arch is formed by 1, 2, 3, 4, pedicle, lamina, lamina, and pedicle. So all these together, they will constitute the vertebral arch that surrounds the foramen, which is called the vertebral foramen. In addition to the arch and body, there are processes. So you can see here a process which passes posteriorly. This looks like a spine, so it's called the spinous process, single. And then 2 lateral processes, which are transverse processes. And then there are 2 pairs of superior and inferior articular processes. So this is a superior and inferior articular process. You can see them here. There are 2 superior articular processes. They allow articulation between vertebrae, in addition to the articulation that is present between the body of the vertebrae at the intervertebral discs. The vertebrae also articulates with each other by their articular processes. So we have superior and inferior articular processes. Also, the pedicle, if you look at the pedicle here, you will find that it is notched. So there's a notch here, very deep notch, and there's a notch superiorly as well. So if you bring the vertebrae together, close together, then you will find that the notches of 2 adjacent vertebrae will form a foramen. And this foramen is called intervertebral foramen. It is between the vertebrae. It is not a deficiency in a vertebra. It's not a perforation of a vertebra, but 2 notches come together and foramen, and so it's called an intervertebral foramen. And the vertebral foramen here, when the multiple vertebral foramina are arranged one above the other, they will form a vertebral canal. And this vertebral canal, it contains the spinal cord, contains and protects the spinal cord and spinal nerves. And the spinal nerves, when they want to leave the vertebral canal laterally, they will pass through the intervertebral foramina, as you can see here. Okay? And in between the body of the vertebrae, there are intervertebral discs, so closely related to the spinal nerves and the spinal cord, the intervertebral discs. And the intervertebral disc is a kind of, it's a joint, it's a secondary cartilaginous joint. The cartilage here, that's located on the periphery, as you can see, is a fibrocartilage. Remember, we mentioned last time we have 3 types of cartilage: hyaline cartilage, fibrocartilage, and elastic cartilage. As an example of a fibrocartilage that withstands a lot of stress, which contains a lot of collagen fibers in it, is the intervertebral disc. So this is the intervertebral disc. The peripheral part of the intervertebral disc is so hard, it's called the annulus fibrosus, and the central part is gelatinous and soft, and it's called the nucleus pulposus. You can just imagine that all these intervertebral discs are all the time compressed. They act as shock absorbers. So usually the intervertebral discs in the lumbar region are subject to the highest amount of stress. And sometimes this gelatinous material, which is present in the center, in the pulp, it might herniate outside, especially if the peripheral part is weak. And this is what we call a slipped intervertebral disc, or a herniated intervertebral disc. It is herniated. It's not actually slipped. The disc does not slip completely, but this is the term that is sometimes used. And in fact, it is a herniation of this central pulp, the gelatinous soft pulp, through the fibrous periphery. And when it herniates, therefore, it will compress the nearby spinal nerves and result in severe pain, like the pain which is some people might experience in a condition called sciatica. So because of the compression of the spinal nerves by the herniated intervertebral disc. This is again to show you that the vertebral column has curvatures. Some of these curves are primary curves, like you can see here in the infant. The entire spinal vertebral canal is curved so that it is concave anteriorly. But when the child starts to support the head, you will have a secondary curvature in the cervical region, which is convex anteriorly. This is about 4 to 6 months of age. And then at about 1 year of age, when the child stands, then you will have the lumbar curvature, which is convex anteriorly. These are secondary curvatures. The primary curvatures are thoracic and lumbar. They remain concave anteriorly. Sometimes there are abnormal curves in the spine. So we have like scoliosis, which is lateral bending of the spine, kyphosis, which is an exaggeration of the primary thoracic curvature, or we have lordosis, which is an exaggeration of the lumbar curvature. It's called lordosis. This is kyphosis, and the lateral curvature is kyphosis. Of course, there are sometimes there are combinations like kyphoscoliosis. You might hear of such combinations as well. The other part of the axial skeleton is the thoracic cage. And you can see that the thoracic cage consists of vertebrae. We have dealt with the vertebrae, the 12 thoracic vertebrae. In addition to that, there are ribs and the sternum anteriorly. The sternum, the other name is the breastbone. The scientific official name is the sternum. The ribs, we have 12 pairs of ribs, and the ribs anteriorly, they articulate with cartilages. You can see here, these are called costal cartilages. So there are the bony part is the rib, and these are costal cartilages. The upper 7 ribs are called true ribs or vertebrosternal ribs, because their costal cartilages, they directly articulate with the sternum, while the ribs 8, 9, and 10, their costal cartilages, they articulate with the costal cartilage above. So this one articulates with the one above, this one articulates with the one above, and then articulates with the one above, and this one articulates with the sternum. So they indirectly, let's say, articulate with the sternum. So they are called false ribs. And yet we have 2 other ribs, the red ones here. Their costal cartilages, they do not articulate with the sternum at all. And so they are floating, not articulating at all. They are only attached to muscles, intercostal muscles and abdominal muscles. So this is how we classify the ribs: true, false, and floating ribs. A rib is a flat bone that is also curved, and it has a posterior end and anterior end. Anterior end articulates with a costal cartilage that may or may not articulate with the sternum, as you have seen. And posteriorly, there are 2 places on the rib. There is a head and a tubercle, and these articulates with the vertebra. So if you look at the vertebra here with an articulated rib, you will see that the head of the rib articulates with the body of the vertebra, while the tubercle of the rib articulates with a transverse process. These articulations allow the movement of the ribs during respiration. When we inspire, the ribs are elevated, and during expiration they are depressed, and so they need joints to move around. And so it is here, the joint between the tubercle and transverse process, and the joint between the head of the rib and the body of the vertebra. The last bone here is the sternum, and it is part of the axial skeleton. It is part of the skeleton of the thorax. You can see it is in the midline. It's a flat bone, looks like a dagger. So it has the 3 pieces. The first piece is like the handle of the dagger. That's why it's called the manovarium, because manos is hand. So this is the handle of the dagger, let's say, manovarium of the sternum, okay? And it has a notch. You can feel the notch here in the midline. It is notched. If you press backwards, you will feel a bad feeling, because you will feel your trachea. The trachea is immediately here, just behind the jugular notch. That's your trachea. And then the manovarium articulates with the body of the sternum, and the body articulates with the what we call the xiphoid process. That's the narrow part of the dagger, the xiphoid process. Sometimes the xiphoid process remains to be cartilaginous, but sometimes it becomes it ossifies and becomes bony. So manovarium, body, and the xiphoid process are the parts of the sternum, and the sternum articulates with costal cartilages on the lateral side. Also, it articulates with the clavicle as part of the appendicular skeleton. Remember that the sternum is a flat bone, and the flat bones, inside them, they contain a marrow cavity containing red bone marrow. And at the same time, the sternum is just beneath the skin, easily accessible. And so that's why it is one of the sites of choice when you want to have a bone marrow biopsy. To examine the bone marrow, especially in blood diseases, they perform a bone marrow biopsy, because inside the bone marrow is the cells of the blood are formed. So in cases of some types of anemia or leukemia, they have to examine the cells that produce the blood cells, and they are present in the bone marrow. So they will perform what they call sternal puncture, and this can be done easily, because the sternum is just beneath the skin. The sternum is one of the bones that contains red bone marrow, not yellow bone marrow. So that's why it is a site of predilection for performing bone marrow biopsy.